I'm Wayne Green, editorial pages editor of the Tulsa World, and I'm talking with Dr. Brad Hardy, a primary care physician at Warren Clinic based at St. Francis South. Dr. Hardy, we're looking at a study that was released recently by the CDC showing that for 1,295 post-COVID syndrome patients reported worse physical health, endurance, function, and pain compared to a control group of 2,395 cancer patients. That's a fairly stunning report, Dr. Hardy. Have you seen this post-COVID syndrome in the Tulsa area?
Unfortunately, I have. While most young, healthy individuals do well with COVID, there is no rhyme or reason as to who suffers long-term sequelae such as post-COVID syndrome. The thing that's most unfortunate about this is that, as I just mentioned, we don't know who will be affected when they get COVID. Those who do, there's a whole gambit of symptoms. I had COVID in October during the early stages of the pandemic, was doing everything right at that point in time as far as practicing social distancing, wearing masks, washing hands. And unfortunately, I contracted it prior to vaccine being available, aside from if you were in a drug study. Even myself, I had what I would consider to be significant health effects for approximately 2 months. 2 months, unfortunately, I did phase out of those. But for that 2-month period, I experienced intermittent chest discomfort, shortness of breath, chest pain, to the extent to where I felt as if I was having a heart attack. If I wasn't, 36 years old, young, healthy, no real medical problems, I certainly would have sought care at the emergency department and had, wanted to undergo echocardiogram to ensure my heart was functioning properly and that I hadn't developed a cardiomyopathy or a balloon or, essentially inefficiency of the heart secondary to COVID. Independent of myself, I've had over 10 patients, I would say approximately 15, have long-term, being considered greater than 3-month courses of illness associated with post-COVID syndrome. Of those individuals, several have had to resign from their jobs, secondary to cognitive decline and mental fatigue, and fog being the primary symptom that most of these individuals have. So others have had residual shortness of breath, where they can't essentially maintain the activities that they used to enjoy. The thing that's kind of striking in this is that the vast majority of these individuals, or actually I would say nearly all of them, are under the age of 50. Within the immunized population, the good thing is that we're seeing high incidence, high acceptance of vaccines in that elderly or 50 plus age group, but the younger individuals are the ones who are most likely not to take it or haven't gotten it yet. It's very, very scary as a physician. And what's also scary is just, we don't know how to treat this. We don't know we don't know who's going to do poorly and who's going to make a full recovery. It's essentially counseling that, we have to watchfully wait. I see some infectious disease doctors doing infusions of vitamins in their clinics. I've not read personally any literature to support this, but it's just, we're kind of shooting in the dark, so to speak. We don't know what we can do to be helpful. And we're just grasping at straws, trying to do everything we can to help these patients recover to the quality of life that they knew before COVID.
So it seems like one of the lessons here is that what we don't know about the long-term effects of COVID infection is everything. We don't know what.
No, we don't know that. And I mean, obviously the longer we're in this, we're gaining more information, but still there's no consensus within the scientific community as to how to treat these individuals or who's going to make a full recovery and who isn't.
Yeah. So as a fully vaccinated person, currently the CDC, as we speak, isn't recommending that I wear a mask if I go out into a public place. But would it be prudent for me to do that anyway?
I think it's definitely your personal choice. Myself and my mother-in-law were actually having the same conversation recently, just um, uh, uh, with increasing numbers within St. Francis. We've had a quadrupling of inpatient cases over the last 6 weeks. So over the last several months, we've been running at about a census of around 20 patients a day being hospitalized for COVID. We got an update yesterday from our medical director of inpatient vice president, Dr. Mark Frost, who gives us our COVID updates. And our census yesterday was up to 82 patients being hospitalized, with 6 of those requiring ventilation. Of those who were hospitalized, the vast, vast majority, greater than 95%, and I read something recently talking about on a nationwide level, it's 99.7% of those inpatient cases being unvaccinated. So you should feel good about being vaccinated as far as severe health outcomes related to COVID, meaning hospitalization. That doesn't mean you still couldn't catch COVID. Okay. So, the Delta variant, it's approximately 99% of cases in Great Britain. It's 60% more contagious than the Alpha variant, which itself was 50% more contagious than the initial strain of COVID. So there is an increased risk for breakthrough infections with the Delta variant in those who have not been immunized. I myself have seen several patients who've been immunized for COVID still contract COVID, not have severe infection to the point to where they have to be hospitalized, but they're still getting the disease and they could still have significant health, sequelae, or they could have poor outcomes related to that in the absence of being hospitalized, even being vaccinated. One of my good friends, who's actually a doctor, recently contracted COVID, and he received both his Pfizer shots back in December, just like I did. Here in Oklahoma, our vaccine rates are unfortunately very low. We're not the lowest. Lowest is Mississippi with a 43% vaccination rate. Nationwide, as far as adults go, the vaccination rate for receiving both vaccines or a single shot of Johnson & Johnson is 60%. So we're going to see these hot spots break out. We're not seeing that the patients who are being admitted right now, unfortunately, are from the surrounding communities more so than the Tulsa Metro, just because our vaccine rates are higher here in Tulsa. That doesn't mean that you couldn't still be exposed to COVID and contract it being vaccinated. My personal take is that if I'm going to be, and this is what I was talking to my mother-in-law about, if I'm going to the grocery store, if I'm going to be in a heavily populated area, I think I'm going to start wearing my mask again, despite what the CDC says, for my own health. It's a personal choice, as so many have said, including Governor Stitt. We have to take our own responsibility, I think is what he said in regards to this. But it doesn't need to be political. It's just we are seeing a significant uptick in cases here in Tulsa County, as well as more prevalently the surrounding communities, just with decreased vaccine acceptance. So unfortunately, we're going to have hot spots for the foreseeable future. I don't think it's going to be as bad as it was last year, but at the same time, I'm not looking forward to this fall and winter, because it definitely will get worse with these increasing with the increasing prevalence of these highly virulent strains.
So just to emphasize what you just said, Doctor, the first and most important thing you can do to protect yourself, protect your family, protect society in general, is to get a vaccination.
100%. If you have not been vaccinated, I would plead with you, or just I'd do everything I could to convince you that you should get vaccinated. This isn't a hoax. This isn't Bill Gates trying to track you. This is just us trying to help the community at large. On a personal note, my grandmother died from COVID on January the 4th of this past year. She was in a nursing home and she died alone. We weren't allowed to see her. She was so close to getting a vaccine and she couldn't. It's just another month and she would have been immunized. And it's just, that's just unnecessary. And it's just so sad. I've had numerous patients die from COVID, and every one of their families, after they die, they accept the vaccine and they all go get it. It's just a question of, why didn't you do it beforehand?
Dr. Hardy, we appreciate your time today.